Hello, thank you for joining the latest one-on-one episode, a video series for Modern Healthcare Custom Media featuring insights from leaders from across the industry. I'm Maria Castellucci, a custom content strategist at Modern Healthcare. On today's episode, I'm so excited to be speaking with Cynthia Powers, Vice President and Associate Chief of Nursing at City of Hope, Orange County. Cynthia joined City of Hope in late 2020 after over 17 years at MD Anderson Cancer Center, where she led clinical operations and projects for both the institution and their cancer network. As City of Hope Orange County's Associate Chief of Nursing, Cynthia is responsible for all nursing care in the Cancer Research and Treatment Organization's Orange County network and leads quality, safety, and innovation efforts. Today, Cynthia will be talking to us about a topic on many leaders' minds today: retaining and hiring frontline nurses amid staffing shortages. She'll also be sharing her thoughts on the future of cancer care. Cynthia, thank you so much for being here today. Excited to be talking to you.
Thank you, Maria. I'm equally excited to be here.
Great. Okay, so I wanted to start with asking about City of Hope's new cancer center that is soon to open in Orange County. As a nursing leader, what excites you most about this new cancer center?
Well, I think there's lots of things I'm excited about. First and foremost, I think the mission and vision of City of Hope, it's so quite compelling to turn hope for cancer patients into reality. That really speaks to me. Words like providing exquisite care with innovative research and discoveries, personalized care, that in alone is inspiring. For me, it's really a once in a lifetime opportunity to transform cancer care, building something from the ground up, a brand new cancer center with really no processes in place, that the sky's the limit to really look at the future of cancer care. And soon after that, we're going to be breaking ground on a hospital that's dedicated solely to taking care of cancer patients. For me, it's just the chance of a lifetime.
That's really exciting. So, obviously, you're going to have to be staffing this new cancer center. So, the long projected nursing shortage is now upon us. How is City of Hope dealing with this situation as you open this new center?
That's a great question. The shortage that we're experiencing affects everyone in healthcare. But here's the thing, the nursing shortage is not new, and there have been many reasons for it. It's been around for decades, actually. The Great Resignation just, I think, exemplified that, what we saw across this nation post pandemic and during the pandemic. But I think that City of Hope's pristine reputation and our commitment to nurses and career development for nursing at every level, it gives us a step up. And we're uniquely situated to help staff this new cancer center and then the hospital. Additionally, even though I've only been here for 17 months, it's a wonderful place to work. I'm actually inspired on a daily basis by what I see nurses and nurse practitioners doing. It's an opportunity to make a difference in really a leading edge cancer institution. And I find that City of Hope invests in their nurses in so many ways, not just career development, but formal mentoring. There's opportunities for both the formal and informal education, going back to school if that's what your desire is, continuing education classes within the organization. And then there's always the ability to give back to the community, which again speaks to City of Hope's real mission. I think that nurses there are prepared to really understand what it takes to care for an oncology patient. And I love the fact that City of Hope has a relationship-based model. It's about treating not just the cancer, but the whole person holistically. And lastly, I think I would say is that we honor our patients and we recognize them as a person, not just a patient.
That's great. Thank you, Cynthia. So, you mentioned the pandemic. So, I wanted to ask you about what were the lessons that nursing leaders learned from the pandemic and how should they be applied moving forward? So, what were your big lessons as a nursing leader and how can you apply them going forward?
Well, I think as always, nurses are ingenious. We find a way to solve a problem, even if it's a workaround. And we saw that really front and center with the pandemic. Things like stand up, drive through testing clinics, things like vaccination drive-through clinics, really thinking of innovative ways to care for the treatments that our cancer patients needed so that they felt safe, and recognizing that we needed to keep our nursing staff safe as well. I think a takeaway for me, one of the big lessons is sustainability. So during a disaster, we can always come together and support one another, roll up our sleeves, and get it done. But this pandemic was different. It lasted for far longer than any of us thought would. And I believe that's one of the biggest lessons is how do we sustain that momentum, that drive in our workforce, and knowing that everyone gets tired, and how do we relieve one another? How do we support one another? Not only from an emotional health perspective, but recognizing that we all have personal lives as well. Another thing that I saw was the incorporation of telehealth. We've been talking about telehealth for years, but fast forward and we're able to, within a matter of months, execute it, and execute it extremely well using our electronic medical records, through our providers, through a lot of different ways. And that in itself was a huge patient satisfier. People could get the answers that they needed face to face with a provider, an advanced practice provider, a nurse, to understand what their needs were. And at City of Hope Orange County, we're planning on opening our cancer center with at least 15 different use cases for telehealth. So for me, it should be here to stay. And I think that's one of the things we're trying to emphasize, particularly in healthcare, where we're always complaining that we're out of space. And one of the ways we can maximize that is really utilizing telehealth in the future in a very systematic and standardized fashion. It's a value for our patients and the providers. And I think lastly is that healthcare has not ever been known for its flexibility or agility, but we had to move forward during the pandemic and do it very quickly. And I'd really like to see this momentum stay in place moving forward, and really want to ensure that that's part of opening up Orange County.
That's great, Cynthia. So you talked about sustaining of your workforce, which is a great segue to my next question. How are you ensuring that nurses stay for the long run? How are you guys trying to retain your nursing workforce?
Yes, well, I know, again, healthcare is struggling with that because competition is fierce, particularly here in California. So for me, coming from Texas, as people ask me, well, everybody's making the exodus from California to Texas, and you went the other way. But I think there's lots of opportunity. I think that first, for me, I've had the privilege of caring for so many different oncology patients throughout the years. And I believe that part of it is it starts with leadership. And it starts with good leadership, motivated leadership, inspired leaders. We need to model the way. And there are both formal and informal leadership opportunities, I believe, in healthcare. And those opportunities require that you engage your staff at all levels. We need to focus on wellness and quality of life balance. And I think City of Hope does a great job of that with many of the wellness programs that they have and that they've implemented. One of the things that we're looking towards is always having a voice for nurses, and that's being able to listen and allow them to voice their concerns. It's more than just a survey. It's providing those forums for those open discussions. But it's not always about what the issues are. It's more so, what is the problem I'm trying to solve? So one of the things we're bringing to City of Hope Orange County for our nursing staff and for our clinical staff as a whole to do this together are think tanks. So we want to bring ideas. I'm having a problem with XYZ. Let's bring the subject matter experts together as a group clinically. Let's bring our respiratory therapists, our occupational therapists. Let's talk about what the problem is. And together as a team, we can come up with those solutions rather than trying to do it as a one-off. Let's do it collectively and collaboratively.
That's great. So you talked about giving nurses a forum. I'd love for you to expand on that a little bit more and talk about what's different about nursing at City of Hope. What's unique about being a nurse at City of Hope?
Well, I referenced it earlier, but the professional practice model at City of Hope really, as I said, it focuses around relationship-based care. And what that means is not just for the patient, but for everyone. So, holistically, we want to look at our patients, our families, but also recognizing our colleagues. We're all people and we all have needs. And how do we communicate best with one another? I mentioned that nurses need to have a voice. It's that listening that is required at every level. And City of Hope offers lots of different communication classes as well as conflict resolution, because let's be real, that is something that we're all faced with. And knowing as nurses, because we're compassionate and caring, we often have times that it's difficult for us to deal with conflict and we shy away from it, but there's opportunities at City of Hope to get stronger in that. And and as we do these things, we become better at what we do, not only from a knowledge base, but also from emotional intelligence. I think also at City of Hope, what nurses say truly does matter. They are the subject matter experts, the line staff nurses. And then I think lastly is that nurses are deeply connected to the mission at City of Hope.
That's great. So we're at the end of our discussion. I just have one last question for you. So you've practiced at some of the most prestigious cancer centers in the country. We talked about at the beginning that you spent over 17 years at MD Anderson Cancer Center. So can you talk about what's on the horizon for cancer centers of the future? What do you see given your expertise?
Well, what we do know is that there's an increasing number of cancer survivors, which is a great thing. It means that we're making advances on really coming up with curative solutions for cancer, and people are living longer as a result of that, which is really amazing. Now, that's also coupled with an increasing aging population, and we know that in the aging population that cancer is more likely to occur. I believe it's 1 in 3. So, what we need to do is to be poised to care for our aging population, for our cancer survivors, and what those care needs are. And those are going to evolve. With new therapies like immunotherapy, some of the latent side effects that we see will be different for our patients. And so, knowing what those are and being prepared to address them as people move into survivorship rather than active treatment is extremely important. And the other thing is clinical trials. That's how we come up with a cure. And the ability for people to participate in clinical trials, making that readily available, whether you're at a community site, at City of Hope, or the main campus. Being able to participate in those clinical trials is where we'll get our solutions and our cures. And City of Hope is heavily involved in innovative research. I think also is this continued emphasis on the patient experience. Consumers are educated and there are expectations, and should not be driven by the institution, but from the voices of our patients in terms of what they need and what has value for them versus what we consider to have value for them. So that's a growing entity, and I expect that that will continue in the future. I think also rapid access to be seen by a provider is critical. So what does that look like in the future? How do we expedite patients so that when a patient calls, we can see them within 24 to 48 hours, not 7 days later? Because there's nothing worse with hearing those words that I have cancer and having to wait for 2 weeks to be seen by someone. So rapid access is critical. From a technology standpoint, I think we're going to see more exciting things like remote patient monitoring from home so that patients can go home earlier, that they're getting discharged and the length of stay goes down for the patient because we're able to monitor and care for them from their own homes. Which leads me to the next point, which is looking into things like hospital at home, where patients again are discharged early and nurses or nurse practitioners are visiting them so that they can convalesce at home rather than sitting in a hospital bed away from their loved ones. So I think the last thing I would like to comment on is really that streamlining that patient experience at City of Hope Orange County, we're going to have nurse navigators that help to follow our patients, not only from the moment that they come to us, but always through that continuum of care, all the way to survivorship and end of life, which I think is critically important to improving patient outcomes.
Thank you so much for sharing that, Cynthia. It definitely sounds like there's a lot of exciting new developments on the horizon for cancer care and treatment. So I really enjoyed our conversation together. So thank you so much for taking the time. I learned a lot. Yeah, it was great speaking with you.
Thank you so much, Maria. I really appreciate having this opportunity.
Great. So that brings us to the end of our episode. To our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms.